The difficult task of providing home health care for urban New Yorkers is a demanding job requiring extreme dedication. The Visiting Nurse Service of New York has been meeting this challenge daily for over 100 years. This long history of service began in 1893, when New York was the teeming gateway to America for millions of immigrants, many of whom settled in the tenements of the Lower East Side. Here in this house on Henry Street, Lillian Wald, a young graduate nurse, founded what is today the largest non-profit home health care provider in the nation. Inspired by Miss Wald's courage and the dedication of colleagues like Mary Brewster, thousands of visiting nurses have followed in their footsteps, alleviating the pain and suffering of hundreds of thousands of men, women, and children. It was Lillian Wald's integration of a visiting nurse service into the community through settlement housing that created what we know today as public health nursing. With the support of prominent New Yorkers Jacob Schiff and Mrs. Solomon Loeb, 265 Henry Street was soon inhabited by other nurses who were to mold nursing history. Among them Jane Hitchcock, Henrietta Van Cleft, Isabella Waters, Rebecca Schatz, and Annie Goodrich. From within this community-based nursing cooperative, Miss Wald is able to link the day-to-day practice of nursing to the growing social concerns of government. She wrote,
"I do believe that the home and the mother are the sources of society. I want to dignify them in every way and have the influences and traditions of the home brought into the government, which so largely concerns itself with the things that make for the home in the real sense of the word: health, housing, and protection."
The visiting nurse's unique access to homes and neighborhoods allowed first-hand experience of the social and environmental ills affecting individual health. Along with the advent of the germ theory came the understanding that disease could travel through an entire population via the social contact involved in the delivery of goods and services. In an industrialized urban environment, there was no longer a separation between an individual's health and the welfare of the community.
The call to the nurse is not only for the bedside care of the sick, but to help in seeking out the deep-lying basic causes of illness and misery, that in the future there may be less sickness to nurse and to cure.
In addition to creating public health nursing, some of Miss Wald's major contributions include establishing the school nurse program in 1902, New York City's first centralized milk station in 1903, and the Federal Children's Bureau set up by the Congress of the United States in 1908.
The full responsibility for the wise guardianship of these children lies upon us. We cherish belief in the children and hope through them for the future, for humanity, for social well-being, for the security of the Republic's future. Let us bring the child into the sphere of our national care.
Good afternoon, ladies and gentlemen. We are speaking to you from Carnegie Hall in New York.
The same combination of practical common sense and courageous vision led her to realize the economy of prevention as applied to the great business of life insurance. It was she who suggested to Lee K. Frankel that the Metropolitan Life Insurance Company should provide nursing service for its industrial policyholders. And from this suggestion sprang the whole movement for support of public health nursing by insurance companies.
In 1912, Lillian Wald is elected as the first president of the National Organization of Public Health Nursing. The following year, New York State recognizes public health nursing by creating a division within its health department. Back in New York City, the visiting nurse service expands all the way into the Bronx. This area, together with Manhattan, is divided into districts with separate staffs for contagious diseases and obstetric cases. Over the next few years, the skills and practical knowledge of the visiting nurses of Henry Street are called upon to combat a major outbreak of polio, as well as the great influenza epidemic of 1918, which kills more than 12,500 city residents. Beside the never-ending practical business of nursing, the Henry Street nurses also support women's rights. Many, like Lavinia Dock, fight for women to gain the right to vote in 1920.
Women are going into public life whether they wish to or not. They have gone into factories, into the professions. They are serving on public committees. They are proposing and even framing legislation. The movement is far greater than the demand for the ballot, and seems to be a force irresistible, one that cannot be swept back.
The day of the visiting nurse in 1920 began much as it does today. Lillian Wald required meticulous record-keeping on behalf of the patients. On this beautiful day, we see the nurses leaving to go into what is traditionally known as the field. This nurse is traveling through the very crowded tenement neighborhood of the Lower East Side. Jimmy is a 12-year-old who has been ill for a very long period of time. Some of the pediatric illnesses that no longer exist, that might have confined him to bed for several months, might have been a very severe case of the measles, whooping cough, or diphtheria. Bear in mind that immunizations then were hardly what we know now. This was an age before antibiotics. There was no penicillin. I would stress to you as you watch this next vignette that the nurse in 1920 was practicing many health and hygiene measures which were quite new then, but are of tantamount importance even today. Notice the frequent hand washing, the very careful handling of the nurse's bag, and the very meticulous care of any equipment that is used for the patient. Nurses today very often have the luxury of using disposable equipment. In those days, a clean cloth apron was placed in the nurse's bag each day. Today, nurses use plastic aprons which are disposed of after each use. We now go with a nurse to one of the outlying districts. The nurse is walking toward what in 1920 was a migrant work camp. Lillian Wald felt that a holistic approach to the family was essential when dealing with any type of illness, but she concentrated her efforts to a large extent on mothers and children. Groups of mothers would come to the local visiting nurse service offices to receive group instruction in hygiene, safety, and nutrition. They learned and in turn taught their friends and neighbors. The mothers were encouraged to promote the hygiene of their children. This was a relatively new concept and not easy to maintain in a house that often lacked for water or heat. Lillian Wald spoke German as well as English. This ability to translate was very important in her work, and when working with other groups of newly arrived women, she would use nurses and assistants who could translate into the appropriate languages. Due to a resurgence of diphtheria in 1927, the nursing service joins the city's public health workers to eradicate the epidemic. Using roving health mobiles, tests are administered and inoculations dispensed. By the end of the decade, approximately 300,000 children have been immunized. As European immigration to New York City declines, native immigration increases dramatically. By the end of the decade, 7% of the city is black. The visiting nurse service addresses Harlem's health crisis by opening local district offices. Lillian Wald's love for all people can best be seen in her support of nurses of color. She gave them the impetus to seek their professional standing in society through nursing at a time when most of America embraced racial segregation.
This question of segregation looms up in my mind as of mountainous significance. It is a moral question that we should not dodge. No surer way could be found to injure the pride, the dignity, and the self-respect of any person or people than to assume that, because of color, race, or nationality, they are unfit to mingle with the community.
Lillian Wald's Henry Street Settlement House hosts the first National Negro Conference, which leads to the establishment of the NAACP. With the stock market crash of 1929 and the ensuing depression years of the 30s, the demands made upon the visiting nurse service increased, while contributions greatly declined.
Governor Smith, as a member of our board of directors, you know how much this 40th anniversary means to us. For 40 years, the Henry Street Visiting Nurse Service has had a tradition of answering every call. Last year, the nurses visited 1,000 patients more each month than ever before. These nurses are the ones who insist that we must answer every call. They know only too well the conditions in the homes they visit.
I congratulate Henry Street Settlement on its 40th anniversary. Founded by Miss Wald, who is today its president, and she in turn is an old-time friend of mine. I lived in the immediate neighborhood of the original Henry Street Settlement House. As a member of its board of directors, I am familiar with its great work. Its nurses make 1,500 visits daily, more than half of which are without cost to the patient. They bring cheer, comfort, and expert advice to the sick and the afflicted.
In 1933, Lillian Wald retires to her home in Westport, Connecticut, taking with her the title Director Emeritus of Henry Street Settlement Visiting Nurse Service. A 1937 radio broadcast direct from Henry Street in honor of Wald's 70th birthday included the mayor of New York City, Fiorello LaGuardia, New York Governor Herbert Lehman, and Sarah Delano Roosevelt reading a letter from her son, the President of the United States.
Miss Wald, before I read my son's letter, I want to tell you how much I think of you and how many, many happy wishes I have for you, that I think his letter will express so much better than I can anything that I'll proceed to read it at once. He says, "My dear Miss Wald, the many years that you have spent in unselfish labor to promote the happiness and well-being of others entitle you to the homage and admiration of all who value disinterested public service. It gives me great pleasure to associate myself with those who are planning to honor you on your birthday. Yet I venture to say that your chief satisfaction will come from the sense of duty so nobly performed through so many years. I wish you great happiness on your birthday and in the years to come. Very sincerely yours, Franklin D. Roosevelt."
Lillian Wald's social vision and moral direction of the visiting nurse service continued until her death on September 2nd, 1940.
And of her, Van Wyck Brooks has said, "She stood like the Statue of Liberty at the port of New York and vindicated America as the land of promise."
By 1940, the staff of the visiting nurse service has grown tremendously. 275 nurses make over 500,000 visits to almost 100,000 patients. In 1944, the ensuing changes in the scope of nursing from simple care to more complex medical practices and the sheer size of the administrative tasks at hand lead to the restructuring of Lillian Wald's ideal into two distinct organizations: the Henry Street Settlement for Social Work and the Visiting Nurse Service of New York for the practice of home nursing. As the United States is drawn into World War II, the demand for medical services dramatically expands the complexity and diversity of nursing care. Visiting nurses are not only witness to the large-scale devastation in Europe, but actively support workers in defense factories and the families of servicemen here at home. Nursing and the science of medicine move into the modern era of technology. In the hope of making new advances in medicine available to everyone, the Hill-Burton Act is created by Congress in 1946. By concentrating on hospital expansion to provide services, the future health of America is placed in the hands of hospitals and acute care providers. Home health care provided by visiting nurses enters a period of change. In the 50s, the Visiting Nurse Service of New York focuses on the specialization of services and care. Physical therapy becomes a nursing specialty when the Association for the Aid of Crippled Children transfers its home service program to the VNS. Staff mental health consultants are added to meet the needs of patients with emotional disorders, and volunteers called visiting friends are enlisted to offer companionship to homebound patients. With the introduction of new oral medications which replace injections, visits to cardiac patients decrease, while work with tuberculosis patients grows dramatically. In the 1960s, a socially conscious population rekindles interest in healing at home. The political sector recognizes the increase in chronically ill elderly citizens and the alternatives for their care. New York City establishes a director of nursing homes and home care services, while the U.S. Public Health Service funds the Home Aid Program.
Visiting nurse service?
To our society, the chronically ill, aged, present a growing concern. As often as not, they can be treated at home, and yet by accidents of time and events, the care they need is not possible without professional help. In the 60s, this is part of the growing role of the visiting nurse.
Of course, when you're older, you're not 100% well, but I only hope I stay in the state of health I am, and I have nothing else to worry about.
For Sadie Ralph, the visiting nurse is the conscience of the community, supplying professional care and comfort, and for an all too brief segment of time, companionship.
Do you find that you're lonesome living alone by yourself?
No, I don't have difficulty. I'm very grateful for things, and nothing seems a hardship to me.
This proud woman, for so much of her life self-sufficient, is faced with dislocation from the home in which she spent the last 30 years. Sadie Ralph is alone and afraid.
When you're coming again?
I will be back again tomorrow.
You will teach me?
Yes, then we'll begin teaching you to put the eyebrows
That's
in
wonderful.
your eyes yourself.
And after that, I can dispense with you, Nancy?
Well, we hope so, if you get used to doing it yourself.
Every day, 7 or 8 patients await her coming. When she was a hospital nurse, she entered every room in a well-established and familiar environment with the full facilities of the hospital behind her. Now, as a visiting nurse, she comes to her patients in every kind of setting. In our society, to be old is difficult. To be old and sick often brings the spirit to the edge of despair. Willard Frank is 70. For many years, he has suffered from severe rheumatoid arthritis. Movement of any kind is very difficult. Sandra Enriquez is terribly important to this courageous man. She comes here twice a week to help him with his bath and to care for his legs and feet.
Able to manage to stay at home this way, then?
Yes, ma'am. I don't want no convalescent homes for me, if it's possible. The inspiration of seeing the buses come here from Connecticut and Jersey, and then all these children and high school people going to the planetarium and the museum. And that's what I want to do next, is hit the planetarium, see what's going on.
See what's going on inside yourself.
The sum total of a patient's well-being is made up of many small parts. The visiting nurse listens, remembers, and cares.
His temperature was 99, pulse 92.
In the course of her work, the visiting nurse becomes a counselor in matters of health. She conducts classes for expectant parents. She teaches and cares for the sick and the disabled. She aids the patient, the family, and the community. In order to better address the increasingly complex psycho, social, and economic problems faced by their patients, the visiting nurse service evolves into an effective multi-service health agency. In 1963, a new pilot experiment utilizing the concept of team nursing is initiated by the Visiting Nurse Service of New York. This team, made up in part by a public health nurse, practical nurse, social worker, home aide, and specialists in mental health and physical or speech therapy, is able to serve a larger number of patients spread over a greater geographical area than at any time in the past. In 1965, the federal government begins direct payments for health care through Medicare and Medicaid programs. The quantity of health care increases significantly, but so does its cost. By the 1970s, as women turn to other professional careers opening to them, the number of nurses diminishes. This decrease in the supply of nurses coincides with a greater demand for their services due to advances in technology, intensive care, and ambitious hospital building programs. Insurers and government agencies must now concern themselves with the escalating national bill for health care, especially the rising costs associated with nursing homes and hospitals. In response to this challenge, government legislation offers home health care as a viable alternative to the institutionalization of sick and aged patients. Through New York State's Lombardi and Cook bills of 1973 and the National Health Insurance Law in 1974. This legislation gives insurance policyholders and Medicare patients the right to request health services at home instead of in nursing homes or hospitals. In turn, the Visiting Nurse Service of New York increases its commitment to the community by supplying transportation to clinics and hospitals. Visiting nurses enter youth clubs, homeless shelters, schools, and hotels for the aged. During the 1980s, infectious diseases emerge once again as a threat. AIDS is recognized as an epidemic disease in 1981. Half of the known cases are in New York City. With a population of 7 million, 25% of the city is poor by federal standards, including 40% of all its children. More than 60,000 people are homeless, and rates of death and infant mortality are climbing. To meet these challenges, home health intake coordinators from the VNS begin to work directly with hospitals, providing follow-up home care to patients after release. New programs that provide private nursing and housekeeping, hospice care for the dying, and support for AIDS patients soon follow. By the end of the 80s, a revitalized visiting nurse service greatly expands its adult and maternal child health services while providing $3 million of free care to the uninsured, underinsured, and disadvantaged. Today, over a century after its founding, the Visiting Nurse Service of New York is the largest nonprofit home health care agency in the nation. With expenditures of over $250 million, the care provided by its multilingual professional health staff of over 3,000 nurses, social workers, and rehabilitation therapists has risen to nearly 1.5 million visits. 10 million hours of additional service is provided by home health aides and personal care workers. This year, over $12 million of uncompensated care will be provided to those in need. The streets of the city have changed, but New York's diverse population's need for in-home medical care remains. Today, visiting nurses face every kind of health concern, from physical and mental illness to disease and disability, from substance abuse and pregnancy to infancy and old age. A multidisciplinary staff of health professionals provide comprehensive care and rehabilitation to everyone, regardless of race, religion, or ability to pay. The modern visiting nurse has a firm background in nursing education and technical skill, and functions as healer, teacher, therapist, guide, and friend. Visiting nurses are the critical link between the physician and the patient who chooses to stay in the community. These patients come from hospitals, city health services, emergency rooms, and social agencies of all kinds. Visiting nurses bring with them medical practices and high-tech services once only available in hospitals. Advancements in portable, state-of-the-art equipment have made it possible for patients of all ages to receive complex infusion therapies and care in their home. The Visiting Nurse Service of New York provides health care to over 1,000 people living with AIDS and HIV infection, 50,000 visits a year, more than all the voluntary hospitals in the city combined. Today's reevaluation of our institutionally based healthcare industry by the United States government is refocusing attention on the progressive social ideals presented over a century ago by Lillian Wald, America's first public health nurse. The Visiting Nurse Service of New York proudly continues this tradition as an integral part of the vast new horizon of government planning and healthcare, ensuring that the coming era's changes in medical and home health services will meet the complex care needs of patients healing at home.